Good afternoon, everyone. Welcome to the Population Health Committee, and thank you all members who are here today. Today is Tuesday, February 20th, 2024, and I hereby call Population Health Committee to order. Clerk, please take the row.
Clemens, Farmer, Helton Haynes, Hemmer, Kumar, Rudder, Terry, Travis. Madam Chairman.
Thank you, Clerk. Before we get started here, I wanted to check and see if anybody's got any personal orders, announcements they'd like to make. Okay, hearing none. I do want to mention that February the 28th is the last day to put any bills on notice for our committee, and the committee will close as of March 5th as of right now. So I did want to make that announcement and make everyone aware of that. So with no personal orders or announcements, we'll be moving on to our agenda for today. We have one bill, which is House Bill 2603 by Representative Johnson. And with that, may I come to the podium, please, and do.
I'd like to request a roll call vote.
Okay. You're ready to present your bill. I like your pink. Very pretty.
Thank you. This bill, HB 2603, if passed, would codify the right to potentially life-saving abortions for anyone under the age of 13. In current Tennessee law, no child under 13 can legally consent to sex, so this bill simply protects these children, all of whom were impregnated by rape. Children under the age of 13 cannot legally consent to sex, partially because their brain's not fully developed enough to make such decisions in a healthy way. With all the ways in which we are failing children in Tennessee, we do not need to punish them further by enforcing a consequence of sex that they are not even able to consent to. These kids are not physically or mentally ready for childbearing or parenthood, and this could affect their future ability to have wanted pregnancies when they are older. The American Academy of Pediatrics supports the right of children to access an abortion to terminate an unintended pregnancy. Childhood pregnancy poses a serious risk of death in underdeveloped bodies, at least 2 times higher the rate than for adults. So children who are pregnant die at 2 times the rate higher than adults. The vast majority of Tennesseans of all parties, urban, rural, and suburban, support this type of exception. 1 in 5 families struggle to access health care, and forcing children to endure pregnancy without guaranteed health care access is all but a death sentence. Rural health care is even more inaccessible. When pregnant children living in a rural area have pregnancy complications, they may have to travel up to 2 hours to be seen, at which point they could become septic or die. Over half of rural hospitals have 0 OBGYNs and can't provide maternal health services to pregnant people. Rural healthcare experts say the elimination of hospital obstetrics units has led to the departure of community-based OBGYNs, creating maternity care deserts, where access to prenatal, postnatal, reproductive, and other health care is very limited or out of reach. The chances of preeclampsia and other life-threatening complications are about 2 times higher in child pregnancy, risking reproductive abilities in the future, risking the life and health of the pregnant child, and increasing the chances of depression and suicide ideation. The bill we passed last year did not adequately provide exceptions for medical emergency, as it was very vague and left doctors unsure when performing an abortion to save the life of the mother is permitted. Because of this, current law does not give doctors the confidence to perform a life-saving abortion far enough in advance to stop medical emergencies before they happen. With passage of this bill, we can ensure that the lives of girls under the age of 13 will be protected in all circumstances. I've taught kids this age, they deserve a childhood. If you force a pregnancy on a 9, 10, 11, or 12-year-old child, they do not get that childhood. They will be reminded every day of what happened to them when forced to carry a pregnancy. Please think of children and vote yes to this legislation.
Okay. Thank you, Representative Johnson. Are there any questions for the representative? Okay. Clemens?
Thank you, Madam Chair. Representative Johnson, could you restate that part where it's illegal for children under the age of 13 that you stated at the outset?
Right. So the reason this bill is under 13 is because legally a child under 13 cannot consent. So if a child under 13 is pregnant, it was a rape. We don't have to determine that. It's already determined based on the code that says you cannot consent under 13.
Thank you, Madam Chair. So, so what this bill is doing essentially is complying with the Tennessee law and just creating that exception for 13 and under, right? Because there's
But
no
under 13.
under 13, so 12 and under. So, given the fact that they cannot legally consent, that means by law, by existing Tennessee code, that child was either raped or forcibly forced into intercourse and impregnated. And that's a very unfortunate situation. It's an unfortunate situation in which we find ourselves with the laws of this entire state with regards to reproductive health care, but especially these young girls that we talk so much about protecting and wanting to protect in this state with laws. It would seem to make the most sense to me to pass this bill in furtherance and to be consistent with existing state law to protect these children. So I appreciate your legislation. I appreciate the thoughtfulness with which you presented this legislation and crafted this legislation. And I appreciate your commitment to protecting, I want to say young women, but these are really children.
Yes.
Go ahead.
And thank you, because, you know, I think we should go further. I don't think 13-year-olds should be able to consent. But I'm working within the laws that we have. Under 13, it is rape. We don't have to prove that that happened. The fact that that child is pregnant means that that child was a victim of rape. And so I just think that allowing them to make that decision and them with their family, unless, of course, we have the situation where sometimes it happened within the family. So whatever trusted adults there are, we should not be forcing children to carry a pregnancy.
Thank you, Madam Chair. And thank you for that, sponsor. And I would agree with you. And I think we should do everything we can to protect these young children in these instances where the consent has not been given, legally given or otherwise. Thank you.
Are there any other questions for the sponsor? I just want to point out an important thing that this bill is saying under the language. So under the language of this bill, I want to make sure that this is all being comprehended in the way the bill is written. It's that a patient under 13 years of age could have an abortion at any stage of the pregnancy and for any reason without the need for a medical emergency or necessity. The only requirement is that the physician must confirm the patient's date of birth prior to performing or attempting the abortion. So the thing that I truly have problem with is that this is any time during the pregnancy. This could be right up to the day before they would deliver the child without any medical problems or anything, that a doctor could perform an abortion. And so I wanted to put that this is what this bill is stating. So
I'd like to respond to that, please. You know, again, if the child and their family have decided to carry this pregnancy, we need to be clear that no one aborts a baby at 8 months because they just decide to. That is a health problem. And it is a health problem, and it's a concern for a 10-year-old to carry a pregnancy, period. Now, certainly we would like that to happen at the very beginning, but sometimes kids don't report early. But to put a number on it, we have to stop pretending as if people decide to have an abortion at 8 months because it's their choice. Nobody decorates their nursery and then decides to abort a child. Those are when serious complications arise. And so will it happen if a child, and maybe a family thinks they want their child to try? They might have serious complications at that time, but no one makes a choice that late to do this. It is because of a serious complication, and we really need to be genuine about when this happens and why this happens at a later stage.
all right, any questions, Chairman Farmer?
Yeah, and thank you, Madam Chair. And I'll make this quick. Just a couple of points. One, I just wanted to follow up with Chair Lady Carringer's remarks there. You know, I'm taken back that this bill doesn't provide any protections for or against any sort of, well, first off, abortion in general, and then late-term abortions especially. Here, I don't agree with anyone. And for you to stand there and tell this committee that there aren't people that are sick enough in this world to abort a child at 8 months, it's happening. And with regards to this piece of legislation, I was surprised there was just absolutely no protections whatsoever in your legislation that would prohibit that. But this allows for abortion all the way up to the day of delivery, for that matter, as it reads in black and white. I'm looking on the computer and reading it right here. And also, you're talking about rape.
12-year-olds are this devious?
Also, speaking of rape, as I'm reading through here, it looks like, and you were right, you know, if a 13-year-old has sex with another 13-year-old and that 13-year-old becomes pregnant, then that 13-year-old is going to be charged with rape of a child. This bill provides no exceptions of two 13-year-olds having sex and becoming pregnant. What your bill does, it makes the assumption that every 13-year-old that becomes pregnant is pregnant from other means other than, I mean, you could have two 13-year-olds having sex, a 13 and 14-year-old having sex, a 13 and 15-year-old having sex and becoming pregnant. Your bill provides no, I mean, it's just, I'm just taken back at the way this bill reads. But with that said, I don't have anything else to say, but I'll be voting against your bill.
Okay. Well, you're mistaken. It doesn't include 13-year-olds.
Sponsor, you're recognized.
Thank you. For the sole reason that 13-year-olds can consent. It's below 13. 12-year-olds cannot consent in any way, shape, or form. Okay? And so we're not talking about how the rape happened, who that was. That's for courts to deal with other things. This just deals with a pregnant 12-year-old, 11-year-old, 10-year-old, 9-year-old. That's it. There's no ability to consent. It was rape if they are pregnant. That will be dealt with in other ways. I'm not supposed to deal with that in this legislation. That's dealt with in criminal justice and in our other laws. This is just to allow a child and their family to protect that child from losing their childhood and potentially losing their life.
Clemens, you're recognized.
Thank you, Madam Chair. And I just wanted to point out that the only reason that our current state law does not include any time limit on the time during which a child could get an abortion is because this body erased that reproductive health care right from the code entirely. So if this body wants to reinstate the reasonable time limit and be consistent with former law, I think we'd probably be open to that, even with some of the things. I'm just curious from anybody who's voting no on this legislation, if a time limit was placed back in the law, are y'all ready to support this bill and protect these young children? That's my question. Thank you, Ms. Chair.
Chairman Kumar, you're recognized.
Thank you, Madam Chair. Thank you for pointing out a very key matter that this bill allows for late to very late term abortion. And the sponsor, as you say, that late term or very late term abortions happen because of a medical problem. Your bill does not say that, does it? Well, it doesn't.
What I'm talking about, the bill does not say that. However, we know, and if we are expecting 12, 11, 10, and 9-year-olds to be so devious as my colleague suggested, maybe that would qualify when you're talking about an adult, but that's not a problem with a 9, 10, 11, or 12-year-old. That's not going to be an issue. But the risk of their life is definitely an issue.
Are there any other questions for our sponsor?
Thank you.
I'm sorry.
Well, I think the answer to my question was really, yes, it does not say that. And you're claiming things in this bill that it would happen only when there is a medical problem, but your bill does not say that. So it leaves the door open for something that is morally repugnant to, I would think, everybody to have a late-term abortion until the day before the baby is to be born. And it is just very, very uncomfortable. You say that would not happen, but your bill doesn't say that. Thank you, Madam Chair.
But research says that and data says that.
Are there any other questions for sponsor? Okay. We're ready to vote? Ready to vote? There's question. Second. Okay, sponsors asked for a roll call, so we will begin the voting.
Clemens.
Aye.
Clemens votes aye. Farmer. No. Farmer votes no. Helton Haynes. No. Helton Haynes votes no. Himmer. Aye. Himmer votes aye. Kumar. No. Kumar votes no. Rudder. No. Rudder votes no. Chairman Carringer.
No.
Chairman Carringer votes no. There are 2 ayes, 5 noes.
Okay, the vote fails, the bill fails, so with no more bills, this completes our agenda with the proper motion. Okay. Seeing no further business, we're adjourned.